Okay, folks, I got to read this opening announcement here. I would like to remind everybody the instructions, including the remote meeting. Everybody asked to speak. Unmute yourself. And put it back, mute yourself. Anybody want to ask a question with a raise the yellow hand. After you finish, we'll knock it off. If you ask any reason you've got to leave, we'll inform the chair or raise your hand. It is a case law. If you haven't heard everything, you can't get involved with the meeting. I'll ask officers now to turn off the cameras and let members only on the screen. Okay. First on the agenda, apologies for absence.
I haven't received any, Chair.
Full team. Number 2, declaring interest. And that goes for number A and B. And then number 3, as Lee says, is a verbal update on the quarter 19 on the services.
Okay, so a quick update then. So currently we've got 8 members of staff off across the whole service that have tested positive with COVID. So although it's still, you know, several staff, that is a much improved position than we were sort of beginning of January. I got to say, COVID's probably not so much of an issue with the service at the minute. It's other illnesses. So we've got quite a few staff off with stress related. You know, we're 2 years in now, and staff are tired, exhausted, and sort of, you know, feeling it now. Especially some that haven't had a break. So we're encouraging people to take leave and, you know, make sure they get that sort of break from the service. Silver and gold have been stepped down. So as you know, they were stepped up some months ago again because of the demands in the health board. They've been stepped down in the last week because it's feeling now with sort of the numbers are coming down, and so we're starting to see a light at the end of the tunnel, which is positive. And then obviously the focus is moving more towards the day-to-day business. And what going back to recovery and starting to think about the future of the service. So the issues at the moment are sort of flow through the hospital. So people are in, well, basically from the front door, from in the community being taken into hospital by ambulance. There's issues around delays there. And then obviously once in hospital, the delays on getting people back into the community or getting the right packages of care or the right care home placement if they require it. So there's been lots of discussions. That's been escalated to Welsh Government on a national basis. So there were meetings this morning with directors of social services, chief execs of the health boards, Public Health Wales, Welsh Government were there, and also Welsh Ambulance Service, all looking at what we can do together to try and sort of help that flow. The feeling is it isn't all about COVID now. It's other related illnesses, you know, heart attacks, strokes. We need to make sure these people are getting support. And I guess COVID is going to be with us for a long time. We just need to get back to day-to-day business now. So that, I mean, that is a sort of a brief summary, really. I'm happy to answer any question.
Please, thank you much. Appreciate it. Any questions from members? Because this is not going to go away. We're going to have this now for the next couple of years. I think every day. I think the COVID jabs will be with the flu. So, any questions? Sharon?
Thank you. Thanks for that, Lisa. You mentioned that the 8 staff was COVID related absences, but then you said about the numbers of the staff members who were on long-term sick for stress. Can you just give us a better understanding of how many, what that looks like for your workforce? How many are off currently with stress, so we can just have that consideration? Because like you said, you know, these people have been firefighting throughout the pandemic, and now it's hit them. Do you know what I mean? In terms of, you know, making sure that, you know, we're doing everything we can to support the workforce moving forward as well, to try and retain them as much as possible, really.
I can tell you there's sort of another 26 members of staff off across the whole service with regards to other related sickness. So it's under 10% of staff. I can't tell you the exact amount of that is stress related, because some of those would be maternity cover, because they've obviously gone off a bit earlier because of you know, the risk of catching COVID during pregnancy. Some of that is like people awaiting operations. So I'd say probably of that 26 is probably about 50-50 split, with those who are off with stress related or anxiety. Others are off with, you know, other issues. Like we've got some people with broken arms, you know, broken legs and things like that.
Right, okay, fab, thank you.
Any more comments, anybody? Lisa, I do appreciate it, thank you very much, and in regards to the staff, hope they get better for you, because as I said earlier on, this is not going to go away. Back to the agenda then, and we got number 4. So it's come to Magari Safeguarding Board Annual Report 2020 to 2021. Is Nicola taking that forward, or?
Nick couldn't make it today, but I believe John is going to take us through the report.
Okay.
Okay, so thank you, Councillor Smith. I have to say it was a really interesting exercise going through this report and putting it together, looking at back with some hindsight on that very difficult time at the start of the pandemic. And it was really interesting to reflect on that. And I have to say I felt really proud of the safeguarding staff in Merthyr and of what was achieved during that time, looking at those things. I just want to start off saying that because it was quite clear to me that despite all those challenges, we managed to achieve a lot against the objectives that we had at the time. So that sets the scene nicely for me to go through it. Now, this is some information here specifically about the Safeguarding Board and what their responsibility is. But I've gone into some detail of what the Merthyr part of that responsibility is as well. So there's an overarching, if you like, Safeguarding Board responsibility, and then what happened more locally. So I think to start with, I think the key word is accountability. It's really important to be and it's a strong culture in the Safeguarding Board to professionally and constructively challenge each other and hold each other to account for what we're doing against our objectives and against our job, and that filters down nicely into Merthyr as well, and we take that very, very seriously, particularly as our focus is not just to protect people but to prevent abuse and neglect taking place as well. And that's a strong theme here, and that we've moved more towards that direction of prevention over time, which, as you'll see, is produced good fruit for Merthyr. So the Safeguarding Board has got a subgroup structure, and what that means in effect is the board meetings make the final decisions, but the day-to-day work is done by the subgroups. For example, audit work or looking at policies and renewing policies and doing that day-to-day work to keep things on track and make sure that the right work is done and the strategic elements are there. So that's all done within the Safeguarding Board. And Merthyr's got a very strong hand in that as a very key partner there. The lead partner, RCT, employs the people directly, but Merthyr is very supportive and a key player in the way that the way things actually work. Not least, I think the reason why MASH is mentioned here, 3.6, is our adults and children protection staff there who deal with working MASH on the front line. That's a key player within the Safeguarding Board, and that's that the RCT and Merthyr was a co-host, as you probably know, in Pontypridd Police Station before the pandemic. But one of the things that we did, which I've got some detail about, is move that to more of a virtual MASH very soon on in the pandemic, which we've got some little bit of detail about. So going into the in 4.0, the summary of the key achievements for that year, it was to enhance and promote a learning culture that can be evidenced, and to have a fully integrated functioning regional safeguarding board. And as you might remember, prior to that time, Bridgend was part of a different safeguarding board, and it came within our safeguarding board structure there, which of course changes many things. We've got an extra authority there, bringing their own views and their own localities. So that was a big time of readjustment, which we dealt with, we were still dealing with during that time. And also to improve the communication strength and structural links between other partnerships in the region. So that was a specific thing we want to focus on that year, and to engage and promote participation with our communities. So that's where we started off the year with those looking for those key achievements. So was very quickly within that year, we found ourselves, like many other people, trying to respond to the pandemic, and to I could go into lots of detail here, but to try and keep it summarised for you and to hit the important points, I think the phrase I've got there just after a little bit down into 4.2, managing the transition to agile working, is something that we put a lot of thought into, and we had a strong focus here on two-way communication. It's really important that staff knew what to do and they knew that how that was going to be done. And it's really important that us as a management team listen to how staff were, what their views were, and how that influences. So the communication sessions were specifically held, but a key element here in this was, in clarity, was having 1-minute guides for the new ways we had to do things in response to the pandemic. So it was written down. We shared those with our partners, and I've shared them, in fact, with my equivalents around Wales as examples of what we were doing in Merthyr, which I was very proud to do because they're very to the point and they're very clear. And I think they were a key element in giving clarity. The last thing needed at that point in this change and this transition that I'm talking about was to have any lack of clarity about what people should do. And that was down to how to use PPE, how to visit children safely, how to triage that, and all sorts of examples to do with that. So that was a key. So communication was a really important way of managing that transition, not least the transition to a virtual MASH. Now that was done through, of course, our individual teams had to be managed, be equipped to manage, but also we had a more strategic managers group across in MASH to help do that, which we stepped down after a while because that works so well. So Safeguarding Board has got some very specific responsibilities and critical functions that they have to do. Of course, during this time of transition, it wasn't possible for those subgroups I mentioned to do those in the same way. So what we did was we moved to a silver and bronze command structure. And again, to summarise for you, we achieved those critical statutory functions within the bronze command largely. And for Merthyr, I chaired that bronze command. And this is before we were able to meet like we are now on MS Teams. This was done using PIN numbers and only with audio only, which brought its own challenges, but it meant that we could do it. But I have to say the response that we had there for the different agencies that work within safeguarding in Merthyr was fantastic. People brought data that we needed. People brought case examples that we needed. We had discussions amongst ourselves about how we could manage challenging situations, and everyone brought energy and time and prioritised it. And because of that effort and that creativity that I saw them when I was chairing those meetings, we were able to satisfy those statutory functions that were enormously difficult to do. So when I said at the start that I felt really proud of Merthyr staff in being able to pull that off, I meant as well our other partner agencies in Merthyr who were part of the safeguarding wider team. That's something that I was referring to, that people really pulled together, and it was an honour for me to be able to chair that. But really, the work was done by these individual agencies, not least children adult services within Merthyr and other partner agencies as well. So that was a critical function that went really well, and it went so well we went to doing it every other week. After all, it was weekly initially, and the silver command, where we escalated things to, that met a little bit less frequently after a while, after we settled in and got into a routine. So it felt a little bit like we just had to do everything differently, but people's energy and creativity really, really worked. So moving on from that, despite 4.4, despite reprioritising the board activities, we still managed to do some of those key achievements I just touched on above, within all of this, so which is another reason why I started saying that I felt very proud that we managed to do this. So 4.4.1, in relation to strategic priority 1, enhancing and promoting the learning culture, at the same time as doing this, we managed to strengthen our arrangements, and we specifically monitored the learning from reviews and audits. Now, probably the best example I have there, I think, is when, now you've all heard, I'm sure, of adult and child practice reviews. You hear in the media that when something goes badly wrong at somewhere in the country, and lessons will be learned and it'll be reviewed and those things. Well, what those are is adult and child practice reviews, where we focus on establishing the learning when something hasn't gone right and making sure that we implement changes. Now, I stress here that these weren't Merthyr cases. There were cases from our region, so RCT and Bridgend, that we were involved in helping them to review, to learn the lessons, but then we weren't going to miss the opportunities, of course, to learn those lessons ourselves. So what we did was we strengthened the communication arrangements and how we achieve that learning and could evidence that learning within social services during this pandemic. We managed to achieve that. and that was in response, not least, to strategic priority 1, enhancing and promoting a learning culture. And then we have to reassure the board then with evidence to show that we managed to achieve that learning, and this is how we can show it. Now, there's a theme running through here, through this report, to with quality assurance, and now a way of showing the board and whoever needs to know, our regulators and yourselves, that we've managed to achieve this learning is through our quality assurance framework, which kind of helps us tie things together. If I pause for breath briefly, Councillor Hughes, do you want to come in if you've got a question now?
Thank you for that, John. And I must agree, when you read the report, you've done excellent work, and the team did an excellent work. But one thing I'd like to know, how come reading this report, how can we have an input into the report to change things? Because it's the information really what you have done. How can we, when scrutinising sport, what can we do to give any input how to change anything? You tell us what you've done, but how can we change the things of what you've done, or what input can we have as a scrutiny group to change anything? We haven't got a plan, few next steps in the plan. So maybe we needed a plan as well as what I know it's going back to 2021, but we want to know what we can do to change things for the future.
Okay, so you're asking, Councillor Hughes, what our plans are, or also how you can influence our plans for the future.
John, sorry, Dave. Can John finish the report first, and then we take it forward? And then we can have all the questions together, because that's the part of mine. Can we? All right with you?
That's fine.
If we keep on to finish the report, then we can get back. Otherwise, we'll be all over the shop.
Okie doke. Thank you, Councillor Smith. Okay, so moving along a little bit, the second priority was to integrate safeguarding activities across the new footprint. Now, without diving into the detail, there were some key bits of work that started during this difficult time, and something that was very straightforward to explain is, of course, the policies we had for RCT and Merthyr. They had to be bridge end as well. An almost piece of work, but people got on with it, and we now have many policies that cover the whole of the region, and of course they've been updated in the meantime as well. Within that, it's worth mentioning, we had new safeguarding procedures that came out just at the very start of the pandemic, so they need to be changed in line with that as well. So there was these layers of complication that were there, and I'm proud to say that I feel that's been managed very well. So in adult safeguarding as well, just very quickly, the new procedures were clear that there needs to be a transition towards them. There was more significant changes for adults. So just this morning, I've been to a meeting to finalise some of the finer details of that. That work is almost complete now, but we started it during the pandemic. It's been a very large piece of work, but we now have consistent adult safeguarding practices across our own region. And Merthyr was a very large player, although we're the smallest local authority. We're very mighty, I have to say, in influencing those, because we're lucky to have lots of experience in adult safeguarding in Merthyr. So we were able to influence things very strongly. We took a strong lead in doing those things. And I want to make a nod as well to the self-neglect policy, which is, again, it's a very strong regional approach. There's been lots of work and again, a good response to that, although there's yet to be tested fully in Merthyr, which is a good thing. But that'll come in time, and we'll be very ready for when we have those tests. So the third priority, strengthening the links with partnerships. A good example for that was something that came directly out of grassroots work through the Bronze Command, was our concerns about the rise in the need for suicide prevention. Without going into the distressing details of that, we had good reason to be focused on that from the data that we had from Bronze Command. So we've got a strategic group now that helps us deal with that and monitor things to help prevent future suicides. So moving on, we've got some data here now. Again, very happy to be able to say very clearly, and you could look at this data in many different ways, but any way you look at it, there's been a very significant reduction in the number of children on the Child Protection Register, and a significant reduction on the number of children looked after. Now, we always say within those sentences a safe reduction. And when we started this, we put the word safe in many times, and still now reflecting back, we're using the word safe many, many times. And I mentioned quality assurance as a theme that's running through it, and what I was doing was thinking ahead to this point where we're able to evidence that one of the chief reason why we've had these reductions has been we've worked in a different way with families, and that's been evidenced through this quality assurance. I have to say, to be very open as well, that we, during the pandemic, of course, courts weren't working as they normally would. It was very, very hard or impossible sometimes to discharge care orders. So that was also a part of the reduction, is that we then caught up with that, which is going to be reflected in the figures for the number of children who didn't have a care order for anymore. So, so that's very clear there in the report. But all things considered, we're able to evidence the safe reduction of numbers of children who we're concerned about their risk or risk of significant harm, and children that we have to look after in order to make them safe. And here we are in a position which the charts clearly show, the blue line being 1 year and the orange line being the following year. And we can see the orange line is clearly below on both of those charts, very helpfully evidencing the reduction. And I'm going to use the word safe one more time, because I'm very happy to say that we've been able to achieve that, which is a very good step forward. We had an inspection as well during this challenging period, and we were found to be safe, with a supportive culture, with valued staff. And I have to say, the culture in the social services department really is very much to value our staff. Their well-being are very important to us, and you can see towards the end of the report that's a theme that's come up there as well as a priority for going forward. So, and I'd never have written this report without mentioning that, as well as positive preventative services from the inspectorate and experienced skilled staff, I was always going to mention that they said we had very supportive elected members. So a thank you to you for your support. It was clearly mentioned by the inspectorate, and we would agree with that as well. So nicely acknowledged there for you. So we appreciate that. Thank you. We also had an internal audit during that time, which again was positive. We were at the very high end of reasonable, which is I've never minded being called reasonable, and it's good that we're at the high end of that. But we were just shy, and I was of course always going to mention this, that we were just shy of substantial, which is the highest measure. And that was a very good process to go through. We used a staff and all staff questionnaire as part of that, which made very interesting reading. But some of the good outcomes from there were an increased safeguarding training for all public-facing staff and yourselves as well. I'm hoping you've all had safeguarding training, or at least many of you, and that's gone well. I hope that was a helpful, interesting process for you to go through. But that came out directly as a result of that internal audit as a recommendation. So, and before we get to the next steps, I have to say this very much is the highlights. There were many other things that we could say that would make me feel equally proud, but I think these ones are the ones that fitted well, or best well, with the priorities from the Safeguarding Board. That's why those are here. There's plenty of other good work that's gone on there as well that I want to give a nod to and acknowledge. I'm sure Taryn would feel the same, and Lisa as well about those things. Next steps. So every year we have different priorities from the Safeguarding Board, and we've just recently been going through that process again. So if you look at 5.0, we need to continue to be adaptable to the changing demands that come before us. We've been doing this for a while now. Agile working and flexible working is something that has become the new norm. So we need to really continue to do that. As Lisa mentioned earlier about having different challenges facing us, maybe as a result of COVID being here for some time, and supporting our staff and people having the right support at the right time from the families we work with to our staff as well is key to this. And we can't assume a one size fits all or that one strategy will work. We have to listen to people and be adaptable according to what is necessary. If we don't do that, we end up being in this kind of professional denial about what the reality is. We have to look reality square in the face. This is what people are saying to us, and make proper decisions on the basis of that. And I've got here in the report 5.3, the well-being of our staff will continue to be actively promoted. And we don't just say this in these reports. When we meet as a management group, we focus on well-being a lot, and we put in some specific steps to do that. It's crucial. We can't do our functions without our staff. They're our best most brilliant resource that we have. We need to make the best of them and treat them the best way we possibly can. We need to embed the adult safeguarding work that's been done, when that's what the meeting was about this morning, was to embed that and have that work properly for the nuts and bolts of how it's going to work, and then test it. We're reviewing child protection conferences, and within that we focus on maximising positive engagement from parents and getting the best safe plans that we can with parents involved in that. And also within that, we've already started using parental advocacy in child protection conferences, which I have to say, a bit of a feather in the cap of Merthyr. As soon as we did that, I had RCT and Bridgen saying, "Well, that's interesting, John, that we have that. Oh, can you send us some information about that?" And they're now copying Merthyr's lead on having advocates for parents in child protection conferences. So a bit of a well done to us there. Self-congratulation for us there, I think. So when I mentioned earlier about communication being crucial to how we do things and listening to staff, 5.6, passion for practice, what that is listening to staff, but not just on a consultative way, but helping them be participative in and giving them a voice in helping us to set the agenda for strategic development. So they said we did approach. So we're listening to the people who are doing the day-to-day work and using their voice to help with our strategic direction. I'll say that as a summary. There's a lot more detail behind that, but I think that's a crucial example of what I said earlier about top-up and bottom-up, top-down and bottom-up listening. We have to have that, and that is one of the reasons why, because we've done that, that's one of the reasons why we've been able to safely reduce the populations I was talking about earlier. Listening to the people who do the work is an essential part of it, as is having a community voice, listening to the people who we serve. And I'll start to finish now. It's coming to the end now about the thread I mentioned about quality assurance going through this. So because it's a thread, I have to have it at the end as well. Otherwise, it wouldn't work. It wouldn't be a thread, would it? I feel confident that as quality assurance is taking additional steps now in the social services department. We've got a full-time employee doing this, where it's been largely in children's services before. It's now going into adult services. That is a way of being able to when we talk about Merthyr Social Services giving quality services and providing quality to Merthyr. That's how we evidence that quality is real, by having somebody check what we're doing, not only to take its temperature to see how well we're doing, but help with a roadmap to know where we need to go next. So we're talking about next steps. Quality assurance is essential to help us follow that roadmap, and it's always a journey. And we have to keep our mind being open to learning. If we think we got there, that's where we go wrong, isn't it? We need to have a continuous learning as an element, and that's an essential part of that. So so in a nutshell, it's been really hard over COVID, but I'm really proud of everyone who's worked massively hard, and we've achieved a lot despite those challenges. We all feel slightly wiser because of it, and we hope that Merthyr is safer because of it. So I don't know if before we go to questions, I probably should give Taryn an opportunity to add, or Lisa, anything to add to that, Lisa, Taryn, before we go to questions.
No, nothing to add from me.
Tom?
Yeah, nothing to add from myself. I think that you've covered everything robustly there, John. The only thing that I would add is that I do think that the passion for practice has been extremely positive for children's services throughout the pandemic, because it's really given staff a voice for how we develop and change our service. And actually it's important to remember that they are the people out there every day visiting families. So it's about leveraging that knowledge, isn't it, for service development, which has been really effective.
Well, I support that completely. If you want to move in the right direction, listen to the people doing the work, you know.
Okay. Okay, John, thank you very much. I do appreciate all your hard work over the last 18 months to put this in together. It's like our social services. You started off with a blank bit of paper. It's come in, it's everybody, and then we've got to change everything. Rules, regulations. Are we doing new planning? I've got people in to support. And don't forget, there's a different support to normal type of support. So if we give my regards to all the staff that work in it, over the moon. So I'm going to ask for that.
Thank you for that. That's really well appreciated. Thank you.
Yeah. So I'm going to ask members, any questions or any comments, we leave till after, because otherwise we get bogged down. So any questions, any Ian?
Thank you, Chair. John, one of the many problems that you've got to deal with is the worrying rate of suicides, which you've touched upon. I was going to ask you about that, but you did touch on it, and I was pleased to note that you've set up a strategic group to deal with this problem. I'm just going to ask you, please, will you make sure that, well, you obviously will be reporting back to us. I take it that you will be reporting back to us on the work of the group, and I look forward to that. Thank you.
You're welcome. Thank you. Certainly will.
Any questions? Lisa, you want to come in? No, all right. Any
Yeah, I
questions?
was just going to say that
Right.
I co-chair the strategic group with the suicide prevention, so we're happy to sort of bring any information or learning that we have from that meeting to future scrutinies, if that helps.
Yeah, welcome, Matt, for members to know, so at least. Any more questions to John on this? Any comments? David, you kicked off? Because you started, I wouldn't want to steal your thunder.
Yeah, well, I would like to congratulate John and the staff, to be honest with you, on the work throughout the pandemic, because you know, I only know only too well how well they've worked and what difficult time it was. My question was before was I would like to see the plan with this report. It's like an information report, which is excellent. I'd be honest with you, telling us how well you've done and what you've done. But I like to see the plan, what we're doing now and in the future, and if we could have discussed that maybe in this meeting here. Right, John? Thank you very much.
Well, you're welcome.
Please.
Yeah, only that we've just devised the plan for, because we had development day about 2 weeks ago, so the plan's being devised to go into Welsh Government for next year, and obviously that will come to scrutiny when it's been signed, well, when it goes into Welsh Government, so we can bring the plan then for forthcoming safeguarding plan.
Any more comments on the members? John, I got to say, the report is good, but there's not enough information about the community in Merthyr. Because when we look at the numbers, cases, number of the children have been in, the adults, all the cases there, right, is multi and it's all the figures in together. So I've been looking for a breakdown for the Merthyr community or the Merthyr Borough, where we can, what numbers we got, what we're dealing with. And the other part is, can we discuss this every 6 months, what plan you got? I know it's an annual plan, but my argument is we're not having no input into it. I know the officers into it, but we are councillors, we're on the ground floor, we want to get involved. And perhaps we have like a workshop every 6 months. What do you think? And we can change certain things. Because we are met with our officers on workshops, and we have worked together and we improved it. So it's all right keeping to the same figures and the reports, but we want to change a lot of things. Like we got a report behind that, right? But we haven't got a plan there. Where's the plan? I know Lisa just mentioned it, but a part of a plan should be there. How we take it forward. That's my whinge.
Okay, can I respond to that, Councillor Smith? So
certainly.
Obviously, the report that's come today is the Contact Morgannwg safeguarding sort of plan.
Right.
So it is sort of across the 3 local authorities. So what we will do is we should bring a report to you just to give you information on Merthyr statistics, so that you can look at adult safeguarding and child safeguarding within our area. So that is something we'll look at. We could certainly do a workshop approach, but I think Merthyr's now got the corporate safeguarding reference group. And we'd welcome sort of members being involved in that, so that they can it's a quarterly meeting. It's not a huge commitment. So we have 4 meetings a year, and then obviously we discuss areas that we need to about things that would affect the community around safeguarding, and that could be domestic violence, or it could be grooming in schools. All sorts of issues are discussed there. And then obviously, as you as members would be able to bring that information about things you pick up in the community that would impact on the work we do. So we'd certainly welcome members being involved in that meeting.
Yeah, Lisa, welcome at one, because I was in a meeting yesterday as a governor. The way some of the teachers are speaking, what plan of action they're bringing to get children speaking. So now 4 to 5, they only speak some one word. So how to get them speaking more than one word in a conversation. So there's a lot of things happening, and perhaps as governing body of some of the schools, and we'll be involved, perhaps we can ask for your support in certain families, because they're not going to come forward, are they?
Yeah, and we are working really closely with education on some of those, you know, preventative sort of pieces of work, so that we can pick up those families early on and sort of offer support in the right areas.
Great. Any more comments from members? No, John, can I say thank you very much? Oh, sorry, Sharon.
Thank you. I was just going to say, no, the overall safeguarding annual report is really comprehensive, and it does break down into each of the local authority areas, and you can see a huge amount of work has been done. I just want to comment on my frustrations of the delays. We February 22, and this is against 2021. So how does it take so long? It feels like we're a long time past this situation now. Do you see what I mean? That was my comment.
Yeah, no, completely agree, and it is frustrating, I suppose, because it has to go through various processes and bureaucracy, and then it goes to the various scrutinies across the 3 local authorities and Welsh Government sign off. And I think COVID doesn't help, because the annual report was delayed going in this year. I think it was something like a 6-month delay. So normally this probably would have come to you sort of September, October, albeit late, but it's been later because it was late going into Welsh Government.
Yeah, I had to double check which year is it, and I was like, oh wow, okay, this is a long time. And it takes a lot of work, doesn't it, to put these reports together, and I just feel that the delays are not helpful in trying to utilize annual reports to inform future planning. But yeah, I appreciate it is what it is, but I just wanted to share.
I think that's a fair point, and I did feel that a little when I was putting it together. It did feel like half a lifetime ago, in that so much has changed since the start of that. So I appreciate the points.
Thank you.
Are we happy? John, thank you very much. I do appreciate it. If with regards to all the staff that's been involved in this report, tell them if the council, Scrutiny panel thinks they've done a marvellous job.
We will. Much obliged.
Don't ask for a pay rise.
Thank you. Next time.
Okay, we'll go back to the agenda then. Number 5. Angela taking this, or? Oh, good God.
Yeah, Angela's going to take it.
Angela, yeah.
I'm okay. I hope you're all well. So I'll run through the report. The report covers the advocacy strategy for adults within Merthyr Tydfil County Borough Council. You can see from the introduction there is a requirement that we provide advocacy under the Social Services and Wellbeing Act. And that then suggests, and it actually specifies in 3.1 what our responsibilities are in terms of delivering advocacy to adults. One of the requirements is that a person is considered for advocacy from the first time they contact social services, which was definitely a new requirement under the Social Services and Wellbeing Act, which there wasn't a requirement for us to do that prior to that. I'm not sure how familiar you are with the term of advocacy, but there are several forms of advocacy, but the most predominant one we see within Merthyr is self-advocacy, and then going on from that, the different types then are informal and formal. So generally, the main form of advocacy we see working with adults is through family members who speak on behalf of their mother, their brother, their child, when they're discussing what their care and support needs. The majority of individuals that we work with are able to self-advocate, and so they're able to express their own views and make the decisions on their own behalf. We had an inspection a while back that identified that we needed an advocacy strategy, and we needed to strengthen our area of that initial consideration of advocacy. And we've included the development of the advocacy strategy in the recovery and improvement plan. Where we were, we had really strong and robust systems in place for the formal advocacy, and those would be in the main for people who were subject to Mental Health Act assessments and those who were under DOLS arrangements. And we used a lot of advocacy as part of any service redesign, and some of you may be aware that we used it for the reconfiguration of the care homes and the work we did with day services recently to look at if there was a potential to change how we were delivering it. Where we are now, we've identified what is required to improve our offer of advocacy to adults, and we've implemented the required actions. However, we still have some areas we need to work on that have been delayed due to the pandemic. That included the appointment of a senior social worker at the adult duty team in the front door, and their responsibility was to enhance the practice of the duty officers so that we are, sort of considering advocacy at that first point of contact as part of the proportionate assessment. In order to make sure that we were doing that, we also then made it a mandatory section in WCCS, which is our database that we record all our assessments on, so someone cannot continue into the next stage of the assessment without considering this and providing some detail on there. We've undertaken a mapping exercise of the existing advocacy services, and there are quite a number of advocacy services within Merthyr. A lot of those are actually provided through the third sector, but what we did note is that a lot of those are subject to short-term funding and had a really narrow eligibility criteria. So once we had quite a few, what we saw were that they were quite narrow eligibility, so there wasn't a general advocacy service for people to access. We developed the strategy now, and the copy is being provided with these papers, and we were supported by the Cwmtaf Advocacy Forum. We were hoping that we were going to do this in collaboration with people who used advocacy services and people we supported. However, due to the pandemic, we weren't able to involve people as much as we would have liked, and there is a plan going forward that we would do that in future. So where would we want to be? Whilst progress has been made, we recognise we still need to continue to adapt our approach. We recognise that we need to improve our data collection to enable us to commission appropriately, and hence our revision of WCCS. And we recognise that we need to promote advocacy appropriately and work on perceptions of how efficient and its efficacy. And we recognise that we need to work co-productively with our service users and our advocacy provider on our approach to advocacy within Merthyr Tydfil. So that's where we want to be. What we're going to do next, we're going to work regionally to expand the advocacy offer for our citizens, reviewing and adopting best practice where appropriate. We're going to utilise enhanced data to ensure that we're taking the correct approach for the commission of services going forward. And we're going to review the provision of advocacy services and promote their use in Merthyr Tydfil as appropriate. And we're going to develop and improve training on advocacy to ensure the correct information on the benefits of engaging in advocacy are being shared with potential users. So if there's any questions, more than happy to answer any. Thanks.
Thank you very much. Appreciate it. Any questions? Anybody? One, just leave a question. Sure.
Thank you. Thanks for the report. So the need has been identified as a requirement of the Social Services and Wellbeing Act. And you've talked about the robust systems in place and the mandatory field in WCIS. So what I want to know now is in terms of the demand for the service. So in terms of that mandatory field now in WCCIS, how many assessments are going through collectively, and of which, how many of those are saying yes to say that they want the advocacy service, just to have a feel for what the demand is looking like in Merthyr?
We haven't had the full report as yet because of the issues with WCCS, and I'm more than sure you're aware of recently. But what we are seeing is we're getting small numbers of people who are requesting advocacy. So we set aside some money under the recovery plan to purchase advocacy because we really didn't know what the demand would be as we sort of increased this. So what we set aside a sum of money so we could spot purchase advocacy. But what we're seeing is really small numbers. And again, we're seeing requests for advocates where people are going through the court protection, and that doubles up in some ways with litigation friends. So it's, you know, it's advocacy on a different level, and that's more formal. And we're not getting many people who are requesting almost like a really low level advocacy. So we're not seeing that filter through, although it's being offered. But people are not taking up as any further, and we still progressing most of the stuff through that formal advocacy. So early days yet, and we want to see how it, you know, sort of where it works. We've got an arrangement and we spot purchase advocacy from Dewis. So we've got advocacy providers. Yeah, we use a group called People First, which is an advocacy service. It's a peer advocacy service for people with learning disabilities. And we've seen that they've been really supportive in looking at developing our day services and really bringing the voice of the service user to the front of that. And I know when we consulted on day services, it was an excellent piece of work that really put it across their views. So, you know, when you're looking at service redesign and redevelopment, using peer advocacy to bring people's voice into that planning system has been an excellent piece of work. And we're doing that not just on Merthyr basis, but across Cwmtaf and setting the priorities for our learning disability redesign as well.
Fab. Oh, that's great. Thanks for that. You know, as soon as we can get the system sorted, that would be really useful to see that the data really in terms of the demand for such services. And I think whilst we trying to get the processes and systems in place, and you know, with things like that mandatory field to remind practitioners that this question needs to be asked, I think there's there might be I don't know, my perception, a little bit more work around making sure clients or potential clients who are undertaking assessments really understand what advocacy is as well, because it might not be something that people think that they need unless it's explained to them in a way that they can understand it. Do you see what I mean?
Yeah, I see what you mean, but I think for adults, I think it's a slightly different position for children. But certainly for adults, what you tend to find is that most people ask their family members to advocate on their behalf on an informal basis. So, you know, quite often we will get, you know, sort of family members bringing up about their mum, their dad. And I'm sure as members, you will see that a lot of family members will actually approach you with concerns.
That's it,
the consent of, you know, the mum, the dad. So I think people feel more comfortable with that informal advocacy with the family member who they probably trust more to put forward their views. Process. So I think we're getting, you know, that's still continuing. So I think, you know, it's where people are saying they've got no one else to act on their behalf or support them through the process. So, you know, we're not getting great numbers, and I know that because of what we're commissioning through Dewis.
Yeah, it was just I was just curious about that demand.
No, as soon as we got the numbers, we'll share them with Councillor Jago. Thanks.
Lovely. Brilliant, thank you. Thanks, Chair.
Okay, Gareth.
Thank you, Chair. Good afternoon, Ange. My questions in relation to paragraph 6.1, obviously taking matters forward. Is there any sort of timetable or time scales involved with that piece of work?
to be honest, Councillor Richards, we've set broad timescales. But if you look at it, our intention originally, this should have been completed at the beginning of, 2020.
Yeah.
So that was the plan in response to the inspection report via CIW. And it's been deferred and deferred. We were holding off, hoping that we'd be able to engage with people who use services, so they would be co-producing the strategy. So in the end, we made a decision that we would go ahead and develop it independently without service users, but used the advocacy forum as a mechanism. So we keep putting dates in truth, and what we keep finding is we're having to push those dates forward. So we haven't got defined dates, but we are working towards it as best we can.
Okay, and as quickly as possible.
And as quickly as possible.
Yes. Yeah. Thank you, Andrew.
Thanks.
Okay, any more questions? And I read the report, and I think it's the way forward now. We got to take this, because otherwise we can't stop still. Things have changed now since the virus has been about, and people want a better service and a better connection. And that's all we need, the better connection, as you said, for people to know what services we got out there to help them.
Yeah, I agree, Councillor Smith. And one of the things that we really wanted to do then, because what we didn't want to do is to go and commission service to an extent that it wouldn't be utilised or was the wrong service. So that's why we're holding off on formal commissioning of a service. And ideally, one of the options we are considering is an advocacy service that sits outside social care going forward, so that people can just approach the advocacy service without even coming through social care. And I know an example of that has been developed in Bridgend that has worked really effectively. But for this point, we just want to try and get some of the figures, what the level of demand is, so that we could develop services appropriately to make sure that they were fit for purpose.
Yeah, I agree with you. Well, now we got to get our community behind us, and we have to change. So we can't keep the same services going all the time. Now we know ourselves. We got to move and change.
I agree.
Anything else, members? Anne's going to say thank you very much.
Thank you.
Appreciate it. Bye. Number 6 then is the recovery transformation improvement update. Lisa, you was there? Lisa?
Yeah, that's me.
That's you,
Okay.
Lisa.
So this is our quarterly update on the recovery, transformation and improvement plan. So you'll be aware of the background as to why the plan was devised, and obviously the plan's focusing on 3 areas: recovery, resources and service improvement, and resilience and sustainability. So section 5 outlines the detail of where we were. Section 6 of the report outlines where we are now, and sort of in 6.4 you'll see some of the projects that we proposed for the recovery funding. So they are things that we've sort of moved forward on with regards to recovery. What I will say in the detail, where you've got the table in section 6, where we've got all the various projects, we've had another 5 of those now completed and ended. So we're sort of now catching up from where we had some delays during COVID. And we've recently had a meeting with the chair and our representative of the improvement board, which was sort of the end of January, and we had really positive feedback as to where we were at. So they were really pleased with the progress that we've made. So we were all really pleased with that. But happy to answer any questions, because I appreciate that was probably quite a quick summary.
It's great. I'm glad the improvement board sees big changes in social services. That's the main thing we're looking at. We thank the staff for that. Any comments from members? Are we happy with Lisa said? Lisa, hey, everyone's happy. Oh, Sherelle, sorry.
Look at the way you announced me, but Sherelle.
You don't want me to say it. Don't say it. All right then.
It's basically just because of the report that we had just before, Lisa. So on page 58, it says one of the actions was to develop advocacy service, and it says it was completed in May 2021, but is that really true? And we just had the update to say, you know, we don't understand the data yet, so we don't know what the demand for the service is. Perhaps that's a little bit.
I mean, Anne just got her hand up, so I'll let her answer. But I mean, the original plans was around developing sort of the performer around what we wanted for advocacy. So that what we originally put into the plan has been completed. There's obviously a second piece of work that needs to be completed now, and that'll be a new project moving forward. But Anne can probably give more detail.
Fab.
Yeah, thanks, Councillor Jago.
Sorry.
I can understand why you think there's a disconnect. The RTI plan was that we would complete an advocacy strategy and how we were going to develop advocacy services. So hence that's why that piece is now closed and completed on the RTI plan.
Right. So it was a strategy rather than, because that says develop advocacy services. I'm like, no, that doesn't make sense. Does it say that's
in the RTI plan? We set ourselves the goal of setting an advocacy strategy and how we were going to improve our advocacy services. That's been completed, and now this is a piece of work that moves on to the next phase of doing that. And in some ways, the RTI plan only looks at that one snapshot and when we started it. So I hope that explains things. Thanks.
Yeah, it does, and that will actually cancel out some of my other questions, so that's fine.
Thanks.
Thank you.
Councillor J, all right with that?
Yeah, thank you.
Gareth?
Thanks, Chair. Ange, my question is around, or whether around 5.6, I think it's Ange would deal with this. Is there any problem at the moment with hospital discharges?
I was just trying to look back to see what 5.6 was then. Sorry, so I'm taking longer.
Yeah.
There is, I think we reported recently on the position with hospital discharges. As you can appreciate, the pandemic, although there has been some alleviation of some staff being off, as Lisa reported earlier on in the meeting, we have seen some real pressures within our domiciliary care services, which are commission services with staff absences through needing to self-isolate, people leaving the service because they feel exhausted, you know, and there's quite pressure on there. So probably our biggest area has been reduced capacity with domiciliary care services to support people to come out. We are seeing some improvements in that, and certainly down in your area, Gareth, you'd be really pleased to know that Sarah Care, there's been no issues with capacity down the bottom end of the valley where we've got a providers, you know, got quite a lot of capacity. But what we find with domiciliary care, it tends to be pockets. So the more rural areas, Podstick, for instance, we do have difficulty in some of the capacity there. But we are seeing an improvement, so that's a positive from today. Care homes, people being discharged care homes has been a real issue, in as much as a lot of the care homes have been going in and out of restrictions, because at one point they could only accept if one person tested positive, whether that be a staff member or whether it be a resident. The home was closed for a period of 28 days, and should a further person test positive within that time frame extended. So, you know, certainly I think it was one of our own care homes, it was nearly a period of 6 months where we were getting, you know, continuing restrictions. We still get it. They've changed the requirements now, where the care home has to undertake a risk assessment as to whether they accept admissions. I don't think a lot of the care homes feel confident, not just within Merthyr, I think across Cwmtaf Morgannwg, in undertaking those risk assessments of if they have someone who's tested positive around accepting admissions. So we're still seeing some periods where care homes are making the decision not to admit people because they've had an outbreak and a number of people. And there is a definition between an incident and an outbreak, which is probably causing a bit of concern. So we are seeing some slowdown in people moving into the care home sector, though again, it is a much improved position than it was previously. And we meet with our health colleagues, well, several times a week to look at all those individuals who are currently in hospital, to look at options as how we can facilitate the discharge. I hope that answers your question.
Yeah, thank you, Ange. Thanks very much.
Thanks.
All right, Ian.
Yeah.
Thank you, Bill. Angela, Gareth has just stolen my thunder here. My question to you was going to be about discharge from hospital and the tension between caring for people at home and putting them into care homes when both options are under severe strain. But you've answered that, and thank you very much. And the other question I was going to ask you was, the report talks about improvements needed in advocacy at the point of first contact, and you've also answered that one very thoroughly, along with everything else. So I'll just say thank you very much.
Right, thanks. I'm glad they've answered anyway in your queries.
Well, see, Ange, they do listen. Huh?
I'm
So
glad
everybody happy with the report?
Bill,
Okay, so
Bill.
Mr. Gareth.
it's just really around timescales. There's a lot of timescales, I think, up in March of this year for various actions to be carried out. Are we aware of any slippage in those at the moment, or not?
No, I think we're pretty much on track with,
Yeah.
we went through last week, we met to go through the RTI plan.
Yeah,
So we've obviously reviewed where we're at on all of those. There's some projects that we'll obviously add to that, as like Anne just talked about, the next stage of advocacy. But these will obviously either carry on, and if we do roll them over, we'll update you at the next quarterly report.
thank you, Lisa. Thanks very much. Thank you,
All right,
Chair.
Dan, happy
Yeah.
with that?
Yep, yeah.
So you're happy with the report, so we go back on the agenda now, and it's the forward work programme. Lisa? Sean, sorry. Sean, are you there? Are you gone?
Yes, I'm here. I'm
Good.
here.
Forward
Okay.
work programme, we done?
Yeah, I don't think there's any changes to the next committee. I'm
No.
not aware of anyway. We've got verbal update as standard from Lisa with regards to the impact of COVID. We've got the corporate self-evaluation, question 3 for social services. And we've got the Vale Valley and Cardiff Adoption Collaborative, the VVC annual report, and the adults and young carers update. So there's quite a few. There's 4 reports on the next. Well, there's 3 reports and 1 verbal update. The next committee.
Okay. Then we got the scrutiny referral, feedback and follow up. There's no action on that. Reflection and evaluation of the meeting. Okay.
Yeah.
Okay. And number 10 is no other business by me. So I'd like to say thank you very much. Appreciate it.
Thank you, Chair.